Today on the Dr. Steve Show, learn what you can do to save yourself some serious surgery later.
This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for joining me today. We're going to feel a lot better and be a whole lot smarter after today's show. Up front, feeling pain in your hip, especially in the front of your hip, well, you could have hip impingement. And joining me now is orthopedic surgeon Dr. Stephen Aviles. Stephen, good to see you.
Hey, thanks for having me.
Another Steve, I like that. We got two Dr. Steves on the show today. All right, so let's talk about hip pain because it's so common. So many people talk about it. What are some of the common complaints about hip pain, common causes?
People come in and they tell you, just like you said, that pain right in the front of the hip. Now that's about 75% of people who come into my office. Another 25%, they'll have pain on the side, they'll have pain in the buttock region, and there are a number of things that can go on in the hip joint. But I'd say primarily, again, pain in the front, particularly with activities and in the sitting position. Right. Long car drives, lots of pain with that.
Okay, so what can that pain lead to if you don't take care of it?
If you keep on getting this pain, it doesn't get any better. Usually for me, my threshold is 6 weeks. Over 6 weeks of pain, then you've got a problem. And I'm worrying about this impingement that you described. And that's when the pelvis and the thigh bone go in together and the bones pinch against each other. And what can happen is that it can violate the soft tissues that surround that area, called particularly the labrum.
Okay, the labrum, which is part of the hip joint in that socket. Okay,
that's right.
So that's what hip impingement is. You have a procedure that can help alleviate this pain. Tell me about that.
This is amazing stuff. This is amazing stuff. We're talking about something called hip preservation surgery. And as the word preservation implies, we're talking about perhaps preventing arthritis. Now that labrum, once it gets damaged, then the hip goes downhill after that and you start deteriorating your smooth surface called cartilage. And once you lose that cartilage, then you're getting a hip replacement. But if we can prevent that from coming back with arthroscopic surgery, little poke holes going in there, repairing the labrum, preventing that bone from pinching again by shaving some of it away, you can actually prevent this process from ever occurring and hopefully stay away from the hip replacement.
Right, so basically what you're talking about is the arthroscopic surgery for people at home is a little tiny camera that goes in. So we're not talking about that big incision on the hip.
Absolutely
It's a simple, much simpler procedure.
Absolutely.
Challenging for you, right, but better for the patient. What kind of recovery are we talking about with something like that?
Recovery can be extensive. Actually, some people have a recovery that's longer than a hip replacement, but is it worth it? Yes, we're talking about preserving the hip. So it can be anywhere between 3 and 6 months to get better.
Okay.
Rehabilitation with physical therapy, but we're talking about 85% chance of getting about 85–90% better, and that's an average.
Right.
Some are 100% better, some are a little less better, but gosh, they're really happy when they're done.
Well, how soon before you can get back to work? I know the recovery can take a while, but you're talking that much time off of work?
Desk job, you're back in 4 or 5 days.
Okay, well, so that's huge. So it doesn't mean that you're out of work.
That's correct.
Completely. It just means that your recovery may take some time.
That's right.
So you could fix structural problems with this as well?
Absolutely. And again, the bone pinching against bone, what you do is that you shave that bone. Almost always, it's either genetic or acquired abnormal contour of the bone. So you're shaving that bone down when you got bone bumps, something we call a cam lesion or a pincer lesion. Shave them away. And you can shave them on the socket, or you can shave them on the ball side.
Right. Now, this is what Alex Rodriguez had done. He had a similar surgery?
That's right. That is correct. Alex Rodriguez had this surgery. Several other athletes have had this surgery as well. And I won't lie to you, the list goes on, obviously because of privacy.
Right. Right. But a lot of people, and the beautiful thing about it is that there's a problem, there's a simple solution, you just have to know about it. Dr. Stephen Aviles, thanks so much for coming in. Really appreciate it.
It was great. Thank you.
Good to see you.
Okay.